It's completely normal to have questions and feel a bit nervous about a medical procedure. I can help explain what a Leep procedure is, particularly in the context of treating HSIL, which stands for high-grade squamous intraepithelial lesion. First, let's talk about HSIL. When you have a PAP test, the lab looks for any abnormal cells on your cervix. If they find HSIL, it means there are significant changes to the cells that could, over time, develop into cervical cancer if left untreated. These abnormal cells are often caused by the human papillomavirus, HPV. Finding HSIL doesn't mean you have cancer, but it's a very important sign that you need a procedure like a Leep to remove those cells. Leep stands for Loop Electrosurgical Excision Procedure. It's a very common and effective way to both diagnose and treat HSIL. The procedure uses a thin, heated wire loop to carefully cut away the abnormal tissue from your cervix. It's also sometimes called a LETS, large loop excision of the transformation zone procedure. The procedure is typically done in your doctor's office and takes about 10 to 15 minutes. It's often scheduled when you are not on your period. You will lie on an exam table just as you would for a PAP test. Once your cervix is numb, your doctor will use a tool called a speculum to get a clear view of your cervix. They may use a special vinegar or iodine solution to help the abnormal cells become more visible. The heated wire loop will then be used to remove the abnormal tissue. You may hear a humming or buzzing sound from the equipment and feel some pressure, but you should not feel any pain. The heat from the wire also helps to seal the blood vessels, which minimizes bleeding. The tissue that is removed will be sent to a lab for testing. This is to confirm the diagnosis and to make sure all of the abnormal cells were successfully removed. You can typically go home right after the procedure. It's important to follow your doctor's instructions to ensure proper healing and to prevent infection. For several weeks after the procedure, you can expect some cramping, similar to a menstrual cramp, and a watery, dark-colored discharge. This can sometimes look like coffee grounds. You can take over-the-counter pain relievers like ibuprofen or acetaminophen to help with any discomfort. Your doctor will likely recommend that you avoid certain activities for about 3-4 weeks, including using tampons. You should use pads instead, having sexual intercourse, taking baths, swimming, or using a hot tub, strenuous exercise, or heavy lifting. Leep is a highly effective treatment, with a high success rate of removing all the abnormal cells in a single procedure. By removing the HSIL cells, Leep significantly reduces your risk of developing cervical cancer. While Leep is considered very safe, there are some potential risks, though they are uncommon. There is a small risk of heavy bleeding or infection after the procedure. You should contact your doctor if you experience a fever, severe pain, or heavy bleeding, soaking through a pad every hour. For some people, a Leep may slightly increase the risk of a premature birth in a future pregnancy. This is more likely if a large amount of tissue is removed or if you have had multiple Leep procedures. It's important to tell your doctor or midwife about your Leep history if you become pregnant. The procedure rarely affects your ability to get pregnant. Your doctor will let you know your results from the lab test and will schedule a follow-up appointment. This is a crucial part of your care. The follow-up may include a repeat PAP test and an HPV test to make sure the abnormal cells have not returned. Remember, a Leep is a routine and life-saving procedure. If you have any questions or concerns, it's always best to talk to your doctor.